Maybe you already have a hypothyroidism diagnosis. Maybe you're taking thyroid medication and you still feel terrible. Or maybe you've been told your thyroid is underactive. You've been given a prescription and your doctor considers the case closed. But the fatigue is still there. The weight isn't moving. And your body still doesn't feel like it's yours. Here's what most providers will never tell you. For a large percentage of women with hypothyroidism, the root cause isn't the thyroid at all. It's the immune system. And if nobody is treating that, medication alone is only managing a symptom of a much bigger problem. So today we're talking about Hashimoto's thyroiditis, the most common autoimmune condition in women, and why it is so consistently undertested, underdiagnosed, and undertreated. Stay tuned. I want to welcome you back to the Unconventional OB. My name is Dr. Tasheema Fair. I'm an OBGYN and a hormone health strategist. This is part two of our four-part series on thyroid dysfunction and metabolism. If you missed part one on subclinical hypothyroidism and why standard thyroid testing is failing women, the link is in the description of this video. I want you to go watch that because it sets the foundation for everything we are covering today. And in this video, we're going deep on Hashimoto's, what it actually is, why it goes undetected for years, what's driving it, what a real management approach actually looks like beyond a prescription. Let's get into it now. What is Hashimoto's thyroiditis? That is a great question. It is an autoimmune condition, meaning the immune system mistakenly identifies thyroid tissue as foreign and launches an attack against it. So, your immune system produces these proteins called antibodies. Normally, their job is to tag and destroy viruses, bacteria, and other pathogens. In Hashimoto's, the immune system produces antibodies specifically targeted at your thyroid gland. The two primary ones are TPO antibodies, thyroid peroxidase antibodies, which attack an enzyme critical to thyroid hormone production. And the second one is thyroglobulin antibodies, which attack the protein your thyroid uses to store and release its hormones over time. And now, over time, this sustained immune assault causes progressive inflammation and destruction of thyroid tissue. The gland becomes less and less able to produce adequate hormones. And what the doctor sees downstream is hypothyroidism, low thyroid function. But the driver is autoimmunity, not just a failing gland. This is a critical distinction because treating the TSH number without addressing the underlying immune dysfunction is like mopping the floor while the faucet is still running. You can manage the symptom indefinitely, but the source of the damage keeps going. Hashimoto's is the single most common cause of hypothyroidism in developed countries. It affects 10% of the general population, and women are diagnosed at rates 7 to 10 times higher than men. Despite this, antibody testing is still not the standard of care in conventional thyroid workups. The majority of women with Hashimoto's are never even told they have it. So, how does this condition that is this prevalent go undetected for so long? Great question. 3 reasons. I got it. First one, I just said it. Antibodies are not tested. As I covered in part one, Most providers order TSH only. Hashimoto's doesn't show up on a TSH test. It shows up on an antibody test, TPO and thyroglobulin antibodies, which are rarely ordered unless the provider is specifically looking for autoimmune involvement. A woman can have significantly elevated antibodies, active immune mediated thyroid destruction, and a TSH that still looks, relatively normal. She's told she's fine. Yep. The second thing, Hashimoto's is episodic. The immune attacks come in waves. During a flare, symptoms can be intense like exhaustion, inflammation, weight gain, anxiety, heart palpitations. Between flares, a woman may feel somewhat better and her labs may normalize temporarily. This pattern makes it easy to dismiss. The inconsistency actually becomes evidence against the diagnosis rather than for it. Third, the symptoms are attributed to everything else first: stress, anxiety, depression, perimenopause, getting older. Women with Hashimoto's see an average of 5 doctors over 5 years before receiving a correct diagnosis. 5 years of progressive thyroid destruction while providers chase individual symptoms instead of the underlying cause. The symptom profile of Hashimoto's is wide and it overlaps profoundly with perimenopause, which is exactly why women in their 40s are so vulnerable to this misattribution. Hashimoto's can present as hypothyroid symptoms, like the slow, low, sluggish picture of deep, unrelenting fatigue, weight gain, and metabolic sluggishness, brain fog and memory issues, depression, low mood, low motivation, cold intolerance, constipation, hair thinning and shedding, dry skin, but it also presents as hyperthyroid symptoms, especially during flares when damaged thyroid tissue releases stored hormone into the bloodstream. Heart palpitations, anxiety, racing thoughts, insomnia, feeling wired but exhausted, tremors, heat intolerance, unexplained weight loss. This is called Hashitoxicosis, a temporary hyperthyroid state caused by the destruction of thyroid tissue during a flare. And here's where women get misdiagnosed again, because when they present with anxiety, palpitations, and insomnia, they get prescribed an anti-anxiety medication and or told that it's perimenopause related. Nobody checks the antibodies. And for women in perimenopause where estrogen fluctuations are already driving mood swings and sleep disturbance, irregular cycles, and metabolic changes, the Hashimoto's layer compounds every single symptom and gets completely buried in the hormonal noise. Yep. Maybe you're asking, well, what are the triggers? Let's talk about that for a minute. Okay? Because this is where conventional medicine almost always stops short. Most providers treat Hashimoto's as a thyroid problem, requiring thyroid medication. But Hashimoto's is an immune system problem that happens to express itself through the thyroid. To manage it long term, we have to understand what's activating and sustaining the immune response. First thing, gut permeability. Leaky gut. The gut lining is the primary interface between the outside world and your immune system. When that lining becomes compromised through chronic stress, processed food, alcohol, infections, and certain medications, larger protein fragments cross into the bloodstream that shouldn't be there, and your immune system mounts a response. Here's the critical piece. Some of those dietary proteins, particularly gluten, have a molecular structure that closely resembles thyroid tissue. When the immune system attacks gluten proteins, it can cross react with the thyroid in a process called molecular mimicry. This is one of the reasons why a significant percentage of Hashimoto's patients show drastic and dramatic improvement on a gluten-free diet, even in the absence of celiac disease. Second thing, chronic stress and elevated cortisol. Cortisol in sustained high levels suppresses the immune system's regulatory function, the mechanisms that keep the autoimmune activity in check. Chronic stress literally lowers your immune system's ability to self regulate. For women managing demanding careers, household, everything, that hormonal upheaval of perimenopause simultaneously, this is an extreme high risk environment for autoimmune flares. Third thing, viral and environmental triggers. Certain viral infections, including Epstein-Barr virus, which causes mononucleosis, and most recently studied post-COVID immune dysregulation, have been linked to the onset and acceleration of Hashimoto's. Environmental factors, including iodine excess, heavy metal exposure, and certain medication, can also be triggering factors. Fourth thing, nutrient deficiencies. Specific nutrients are critical to both thyroid hormone production and immune regulation. Selenium, zinc, vitamin D, iron, and B12. Deficiencies in these, which are common in perimenopausal women, directly compromise the thyroid's ability to function and the immune system's ability to self regulate. Got it? Here is where conventional and functional medicine approach diverge significantly. There's a big, huge, dramatic difference. The conventional approach to Hashimoto's: confirm the diagnosis. If antibodies are tested, prescribe levothyroxine, synthetic T4. Monitor TSH periodically and consider the case managed. No investigation into root cause, no dietary intervention, no gut assessment, no nutrient panel, no discussion of immune modulation. Here is the problem. Levothyroxine does not treat Hashimoto's. It replaces the hormone the damaged thyroid is no longer producing in significant quantities. It doesn't stop the immune attack. It doesn't reduce the antibody levels. It doesn't slow the progressive destruction of thyroid tissue. Many women on levothyroxine continue to express symptoms because the underlying autoimmune process is still active and nobody has addressed it. A more complete approach includes full antibody testing to confirm and monitor Hashimoto's, not just TSH management. Evaluation of conversion issues, because many patients don't convert T4 to T3 efficiently, meaning levothyroxine alone is insufficient. These women often do better on combination T4 T3 therapy or natural desiccated thyroid. Gut assessment and dietary modification, gluten elimination trial, inflammatory food removal, gut healing protocols. They need a comprehensive nutrient panel. They need selenium, zinc, ferritin, vitamin D, B12, and magnesium. They also need a cortisol and adrenal assessment because adrenal dysfunction and Hashimoto's frequently coexist. We also get to do a toxin and infection assessment. checking for heavy metals, Epstein-Barr reactivation, and other known autoimmune triggers. Okay? Now, here are your action steps from this video. If you have a hypothyroidism diagnosis and you've never been tested for antibodies, go back and ask specifically for TPO antibodies and thyroid globulin antibodies. This is non negotiable for understanding your actual diagnosis. If you have confirmed Hashimoto's and you're on levothyroxine but you still feel symptomatic, ask your provider about free T3 levels. If your T3 is low despite normal TSH and T4, you may have a conversion issue. Ask them to put you on T4, T3 therapy, either synthetic levothyroxine along with levothyroxine or natural desiccated thyroid. You need selenium supplementation. 200 micrograms daily has been shown in multiple studies to reduce TPO levels. Check your vitamin D levels because low vitamin D is strongly associated with autoimmune flare activity and a referral to an integrative of functional medicine. If your provider is not willing to look beyond TSH management, and if you haven't been diagnosed, but this video is describing your life, print the complete thyroid panel list from part 1. Add TPO and thyroid globulin antibodies and bring it to your next appointment. Or click the link that's in the description of this video to get your labs done, and we'll get you some answers. All right, now in part 3, we're going into treatment. The full conversation about thyroid medication options, including why some women need both T3 and T4, why natural desiccated thyroid is underutilized, and what your options are when medication alone isn't giving you the life you want. In this video, this is the video I wish every woman had access to before having the thyroid medication conversation with her doctor. If part 2 was an eye-opener for you, please share this with a woman who's been on thyroid medication for years and still doesn't feel well. She needs to hear this. Drop a comment below and tell me, did you know about Hashimoto's before this video? Or is it the first time someone explained the autoimmune piece? I want to know. Subscribe to this channel, and I will see you in part 3. Listen, you were not built to feel this way, and now you're starting to understand exactly why and what to do about it. In the meantime, in between time, stay healthy, stay vibrant, and stay unconventional. I will see you in the next video. Peace.